Greetings and welcome to Vanderbilt University School of Nursing's Informatics 101. I'm Patty Sengstack and I'm the director of the Nursing Informatics program here at the school.
And I'm Alvin Jeffrey. I'm a postdoc fellow at the Department of Veterans Affairs and also on faculty here at Vanderbilt University School of Nursing.
And I'm Sherry Just. I'm a registered nurse that works in health IT here at Vanderbilt University Medical Center.
And an expert on the topic of the day.
Correct.
Wait, so what's our topic of the day?
Our topic of the day is clinical decision support. So a lot of people just call it CDS, and that confuses people. We don't like to use acronyms, so feel free to stop each other if we do use an acronym during this session.
Yeah.
So clinical decision support. And for those of you who've not heard of this term before, I think we have a definition from one of our professional organizations.
Right here. I always carry a definition of decision support with me.
Beautiful.
So this comes from the Office of the National Coordinator for Health Information Technology, and it says clinical decision support, or CDS, provides clinicians, staff, patients, or other individuals with knowledge and person-specific information intelligently filtered or presented at appropriate times to enhance health and health care. CDS encompasses a variety of tools to enhance decision-making in the clinical workflow, and these tools include computerized alerts, reminders to care providers and patients, clinical guidelines, condition-specific order sets, focused patient data reports and summaries, documentation templates, diagnostic support, and contextually relevant reference information, among other tools. Can I get a glass of water?
Yeah.
That's a lot.
It is a lot. So let's maybe try to unpack that a little bit. And Sherry, maybe you can help us to, speak about it as if you're speaking to a relative. What is your experience with clinical decision support? How is it used?
Clinical decision support can be used in a variety of ways. I mean, as the definition says, people tend to think it's just physicians, but it's actually clinical staff. It could even be patients. When what the intent is to put that information, at the right time in their, workflow or their everyday activity so that they, get the correct information.
And is this through, I'm going to assume, but correct me if I'm wrong, that this is through the electronic health record that people are interacting with? Or
It could be, most often when we think of clinical decision support, we think of our EHR. But it could also be part of like a patient portal. It could be the mobile applications that, both physicians and patients use. So it's not always strictly EHR.
Okay.
Could it even be on paper?
Sure. Typically, with decision support, one of the definitions, or part of the definition, was intelligently filtered and presented at the right time. So typically we think more computer or some type of a device, just because that allows for that kind of filtering. Now, certainly a lot of what's presented, they can, a patient can print out or a physician can, print out. So, but it's typically presented in more of an electronic format.
Okay. Cool.
And, when you hear the term clinical decision support or CDS, people tend to think immediately about an alert that pops up in front of their face to remind them, and they get annoyed with it. But it's bigger than that, isn't it? What are some of the other aspects or the other things that comprise CDS?
I think the Office of the ONC, the Office of
The
National Coordinator of Health Information Technology, said it perfectly. It's not just an alert. It's also documentation templates. So as nurses are filling out a flow sheet, their answers to something might cause other questions to come up. That's a form of decision support. It could occur more as a info button. We're used to seeing info buttons in the medical world.
Yeah.
So whether that be an info button for medications, that gives you a little bit more information. It could be the task nurses often have a task list. So that is often decision support too, based on answers to either an intake form or a flow sheet. A task will appear on a nurse's work list. So it's a wide variety. It could be even order sets. People don't think of order sets that physicians use as clinical decision support, but you can present them the right things based on a patient's diagnosis or a patient's, what part of the hospital they're located in,
Or maybe
their age.
maybe based on evidence-based guidelines.
Exactly.
Order sets created from guidelines.
Right. And a lot of that, it can even, within order sets, oftentimes we'll do links, or within an alert or a documentation template, you can do links to that evidence. So it provides that information to the provider. So it gives that rationale for the decision support.
So this almost makes me think about something I've heard about that you can probably tell us more about, is these 5 rights.
Yes.
As a nurse, we know about the 5 rights of medication administration, but I've heard about these 5 rights of clinical decision support.
Right. And the reason the 5 rights really came about is because you have most of the time people think of alerts. And so if you don't present an alert in the proper way, the number one pitfall with clinical decision support is alert fatigue. And so when you start presenting too many alerts and maybe at the wrong time, what happens is physicians, clinicians stop looking at those alerts, stop paying attention. So part of that, a way to mitigate that, is by the 5 rights. So those are the right channel, the right intervention, the right, I always have to think, the right information, the right person, and the right workflow. So some examples, so if we start with channels, like you were saying, it's not always an EHR. It could be a portal, a patient portal. So you have to really look at what is the best, channel to deliver that information. With our intervention format, is it an alert? Is it an info button? Should it just be, a link within a documentation, template? You want to do what makes sense for what you're trying to achieve.
So it's just, if I had to put it really simply, give me the information that I need to make a good decision for my patient who's in front of me right now.
Correct.
Is that a good way? That's like the easy way of saying
And
it.
present it to the right person. So if I'm the nurse and I'm getting stuff presented about, what should be ordered or I might not be the right person. A lot of times what we'll have in CDS is, one group recommending decision support for another group. And that you really want whichever person is going to get that CDS to be involved in that CDS. Make sure it fits in their workflow. Make
Okay.
sure it's just not a one-off.
And I feel like you've said the word workflow a lot, and that seems to be something perhaps that's missing in a lot of our CDS of a
Yes.
consideration for workflow.
Yes.
Because I know for me, being a pediatric critical care nurse by background, I could tell you the workflows of respiratory therapists versus nurses versus physicians, even residents versus attendings can be very different.
Right.
And so you're saying that you really have to tailor that to the workflow of the person who's going to be receiving the
Yeah.
information.
And
That
that's,
seems hard to do.
it is part of what I think as we get more familiar with EHRs and our clinicians become more savvy. Part of the problem is that you have clinicians that will recommend solutions. And, we want this alert that will prevent, XYZ from happening. The problem is that the alert might not be the best, solution. And so that's where workflows come in. That's where is the right person getting it? Are you presenting it in the workflow? Because if somebody has to go out of their workflow,
They're not going to do it.
they're not going to do it. And their the effectiveness of that CDS becomes less.
Absolutely.
So Sherry, how many times have you seen that where, because I know I have, and I know your answer is you see this a lot, where you have a request that comes in where somebody believes that having some kind of an alert will act as kind of the police. And
Yes.
we think that if this alert pops up, will ensure that the nurse, in our case, will do X. And so, tell us a little bit more about that. I mean, what do you think? What's your opinion? Do you think that the EHR can pop up alerts and help nurses do what they're supposed to do?
I think that what CDS should do is help a nurse to do what they're supposed to do, not necessarily, force a nurse to do what they're supposed to do. So a lot of what we do, like with nurses, is put up instead of taking and utilizing decision support for when a nurse does not do something, and maybe reminders in a task list or something like that, we put it more up front to make sure everybody does it. So that kind of can contribute to that alert fatigue as well.
Right.
Where
does it fall in the workflow?
Exactly.
Yeah.
Exactly. And because decision support historically has been physicians, I think a lot of EHRs, there's not a lot of workflows where they really interject CDS in a nurse's workflow, other than when they're documenting or administering the meds.
Yeah.
And so I think that's becomes a little more difficult.
Do you think that's our fault as nurses? What do you see as the opportunities for nurses and informatics nurses to change that?
That's it. I think when clinical decision support first came about, it tended to be physician. Everybody thought of physicians, but a nurse informaticist is the ideal person to be looking at those nursing workflows, to look at what do we need to do, or do the analysis and help design, and then also even push back to an EHR vendor, to say, we would like to do this, to help guide our nurses.
So I liked your question. What should we think about as nurse informaticists? So one of the things, Sherry and I actually work together on a committee that looks at CDS for nurses. And I know that one of the first things that we've done is to look at the data.
Yes.
Now, see, this is right up
I
your
love
alley,
data.
isn't
Yes.
it?
Yes.
I forgot my data nerd
You
shirt.
did forget
Yeah.
your data nerd shirt. And so what we asked Sherry and her team to take a look at is how often are certain alerts firing for nurses, and how many of them are interruptive alerts. And I remember that there were quite a few that were interruptive.
Yes.
And so Sherry's, you tell about your recommendation to us based on the data.
And one of the things, the one that we worked on with the med administration was the perfect of, we're alerting, everybody, as opposed to what we really probably wanted to do. This particular alert alerted a nurse when they were giving a dose of a medication too close. But the problem was it alerted on a lot of things like a sliding scale insulin, that you might give, off, not in your typical hourly. But part of that is, what do we want to focus on? Are there certain medications that we can focus on, so when a nurse sees it, they know it's a serious alert, versus I'm seeing this all the time for, insulin, I'm seeing it all the time for this. So, I'll just kind of click right through it. So that's what's important. And I think that kind of goes, a nurse informaticist can really, in designing that, I think the pitfalls people make with designing CDS is nobody thinks about what's our success criteria.
That's a great point.
And if we don't know what we want to achieve from this, we veered off from providing the best decision support we can.
Would you
And that was our thing with our, the BPA or the alert, CDS alert that we were looking at, is we just implemented it, but nobody really knew.
And my experience is that happens way too often.
Yes.
People believe that a best practice alert, or BPA as we call them, or reminder, is going to fix everything. And so we implement it, put it into production, and then walk away. And so I think that as nurse informaticists, we have a real opportunity to look. And so that's one of the things that we've been doing, is looking at how many alerts fire for nurses, how often are they firing, how many are interruptive, which ones are really important, how do we prioritize them, is it high-risk medications? And so those decisions, I think, are all under the purview of what nurse informaticists do. And I think is really important work, because if we can stop them from ignoring the really important alerts, we have an opportunity to improve the safety of our patients.
Exactly. And I think that's the key, is that what we're trying to do is, avoid errors in any type of adverse events. We want to improve patient care. Those are the things that are difficult when a provider is just getting a lot of alerts throughout the day, a nurse or a provider.
Yeah.
So I'd love to capitalize on that high point, that it seems like the goal of CDS, or decision support, and the importance is around quality and safety. And so things that we've talked about to support that are important, I think, is that it's not just physicians, it's not just alerts. CDS is a lot for a lot of people in a lot of different formats. We've emphasized workflows and being the right workflow in the proper way, and talked about some of the challenges of alert fatigue, and that CDS should really assist us and not force or interrupt, and it should be supportive. So does that summarize?
And I'll add one point to that, that it should be designed by the people that are going to be interacting with it.
Yes. And I think all of those, adhering to those 5 rights of CDS, really is how you get effective CDS.
Wonderful. Yeah. Well, I want to thank you, Sherry, for joining us today and answering our questions. We really appreciate it. So,
thank you.
I want to thank you guys for listening in. We hope that you'll share the video with your colleagues, whether through social media or email. You can contact us with questions or feedback at the link below. And until next time.